I'm Carol Zusin, and I live in Westford, and I've been here for 49.5 years. My whole family has what you call thalassemia, which is a form of anemia. It's a trait. That means that our hemoglobin is low. And my primary care doctor, Dr. Kennedy, referred me to Dr. Dubois.
I think Carol was probably one of my first patients out here. I met her when she had more of a benign or easy to manage blood condition. One of her normal blood cells, the platelets, were high.
And they found out that my bone marrow was, I had fibrosis of the bone marrow.
And she really started to describe just not feeling right. She was fatigued and just knew something was up in her body. And it was at that time we had to do more investigating, including a bone marrow biopsy and aspirate, to look at the factories that produce blood. And it was that first time where we were starting to get concerned about a much more serious blood condition, even a leukemia.
You know, my hemoglobin kept going down. And then finally it went down really low, so he decided that it was time for me to go to Mass General. He had a doctor that he thought I would really like, and that was Dr. Ballin.
Dr. Ballin at the time was the director, and still is the director of the Leukemia Service, and was really, in my mind, the right person, both from a human perspective to connect with Carol, but also the expert who could manage the condition.
When I met with Dr. Ballin, we decided that the stem cell was the best choice. And my sister Josephine had already been tested, and she was a perfect match.
And I can always count on Karen to not just manage the disease, but also look at the patient as a whole. And I think that's a very important and very critical aspect of being a hematologist.
I didn't know that there was an affiliation between Mass General and Emerson Hospital. But now that I do, I'm very pleased. I can't tell you how important it was. When I went to the hospital and I saw Dr. Ballin, she'd always tell me that she spoke with Dr. Dubois and what he said. And then when I went to Dr. Dubois, he would tell me that he spoke to Dr. Ballin. And I always felt that they were connected, that they always knew about my care and what was happening.
The diagnosis of acute leukemia was made, and it was really thereafter that Carol required a significant treatment called a bone marrow transplantation. And this was a procedure where she required bone marrow from a donor to really replace her bone marrow or blood factories that were diseased with the leukemia. Carol had the bone marrow transplantation in August of 2011, and then required very intense care both at Mass General and then transitioning back to Emerson Hospital. And it was really a collaboration between Dr. Ballin and myself to be able to care for Carol and meet her needs both at Massachusetts General Hospital and also out here in clinic visits.
If I had any questions along the way that I forgot, you know, what they had said, they always, you know, made sure that they explained it to me and that I understood it. They said it in terms that I could understand.
I think that the focus has to be on the patient and meeting the patient's needs. So it's not just about a physician caring for a patient. There's an entire team of nurses, nutritional support, psychological support, support to family members that is so critical in getting a patient through a serious illness like leukemia. And for Carol, both at MGH and out here, we were able to provide that.
I really feel wonderful, and now I'm almost back to normal. I can go shopping by myself now. I can drive my car by myself.
Since Carol's bone marrow transplantation in August of 2011, she's actually done great. She still follows up both here and also with Dr. Ballin at MGH. Her blood levels have been good, and she, in my mind, has really gotten back to a very nice quality of life. I think in our field, despite the success of a particular chemotherapy or perhaps a procedure like a bone marrow transplantation, my goal or my win, so to speak, is when I see a patient get back to the quality of life and the life that they had left before the illness.
He always personalized everything. He's always thinking about your well-being, you know, and you couldn't ask for a better doctor. The whole team is wonderful. Everybody is wonderful at Emerson. They're really great. My whole treatment, both at Emerson, you know, through all my surgeries, everybody was just so good. And they went above and beyond. I've had doctors come off a trip, and you know that they just got off the plane and they come in to see you to see how you're doing. You know, they just go that extra mile for their patients, and all the patients feel it.